Welcome to Food for Therapy. I'm your host, Marie-Therese Bolden. Welcome to my show, the show that combines my specialties and training of psychotherapy, counseling, personal development and writing with my love and passion of food and hosting and culture. And on our very first episode, let's welcome the wonderful Dr. Euahna Varigos. Welcome to my home and welcome to my table. And our very first ever episode is going to be about a topic that affects millions of women around the world, and specifically me at this moment, which is menopause. Welcome to the table, Euahna. So good to see you.
Thank you so much for having me.
You're welcome. And Dr. Euahna, you are a specialist anesthetist and an adjunct practitioner. That's a mouthful, which means a combination of alternative. We don't like to use the word alternative, but all-encompassing therapies.
I think I might just explain how I came to be here, because most of my patients do ask me, how is it that you're an anaesthetist and yet you're using laser acupuncture, photons, and I also include nutrition. And it was part of my I don't like journey as a word either, actually, but part of my change of moving into pain management. Mm-hmm. And I didn't want to rely on drugs, which was very much the forte back in 1994. And so I just moved into laser acupuncture, looking at other alternative ways. And that introduced me to practitioners, GPs, who had already started using nutrition, integrative medicine, and they were looking at other ways of helping patients rather than just relying on scripts.
So for this episode today, the format of the podcast is that we will always have a food to support the topic. And I really wanted to have a salad niçoise because, you know, salmon, fish, they all contain omega-3. Is that correct? Yes. Omega-3 for the brain, which, as you know, as you transition through menopause, your brain starts to get foggy. You start to become incredibly overwhelmed and forgetful. The eggs are a wonderful source of protein. The greens have a beautiful source of vitamin C. The potatoes, we can eat potatoes. We don't have to, shy away from, complex carbohydrates, as long as everything's in moderation.
Moderation
yes.
is the key. And just looking at this plate, colour.
I know.
There is no doubt that colour is important. You must introduce different colours into your diet, and go with what is current in the season, because that's the other thing that I think is not happening as much now. We're not eating seasonal. We can buy everything all year round.
Right.
So you tend to sort of eat what you like more than choosing seasonal things. So it's always important to have seasonal food, I think.
Yes, definitely.
In moderation, and colour.
Yes. Because colour represents, my mother used to say that, Euahna, colour represents the different nutrients that you're absorbing, And so, I'm somebody that really, really doesn't like to fuss too much about food. I love great food. I love eating a combination of different foods, but it has to be simple for me because my life is, like everybody's, busy and hectic. And we want to make sure that, we've got time to actually enjoy it. So
that is important. And also I come from a Greek background, so I have I was brought up with a Mediterranean diet. My parents were born here.
Yep.
However, we still had a Mediterranean diet of olive oil. And just as an adjunct, a sidetrack, I remember going to a girlfriend's house for lunch very early on. I was only probably about 10. And they were English. And we had the formal Sunday lunch. And then I remember while I was helping tidying up, on the windowsill, there was this lard, I think is what she called it.
Oh, wow.
And that's right. And I went home and I had no idea what it was. I said to my mother, there was this stuff and it was called lard. And my mother had to explain what it was because I'd never come across it.
Yeah,
I'd been brought up with olive oil.
Same, definitely Egyptian.
So we were very fortunate. Because now everyone wants.
I know. Don't you find that?
Talking about the Mediterranean diet,
the cultural appropriation, which I'm all about share, and we can all share in everything, and that's how we all benefit. It's a benefit for all when we share cultures and food and knowledge. But growing up in the 70s, it was, you know, we would get made fun of at school.
I did have, yes, because I'd have olives and you know, the girls would look at me, and then I'd have my lovely gaftetas and my other things.
I know.
Stuffed vine leaves.
I know.
And my girlfriends I went to a small girls' school, so basically they would look, and I was the only girl in the whole school of Greek or Italian, any heritage, actually. Yeah, apart from Anglo-Saxon.
I know.
And
you know, I know a lot of people are going to be wondering how you and I came to connect. And really, you know, the genesis of my meeting you, and I don't believe that it was coincidence, because I don't believe anything is coincidental. You know, I started the change and the transition through menopause, and was speaking to my gynecologist, and we discussed HRT, hormone replacement, and I said to her, I don't want to do hormone replacement. And at the time, I didn't have as much knowledge as I do now about, you know, the benefits versus the cons of HRT. But of course, she said there is a doctor, and she does specialize specifically in laser light acupuncture. And I thought, oh, well, that sounds interesting. And the fact that she recommended you and that you were all-encompassing in that way, to me, was delightful, because really the fact that you're, you know, medically trained, and science is science, it's a faculty, it's empirical evidence, and we need that. But the fact that you acknowledge that we're not just a body, and we're a mind, and we're a soul, was, to me, really the most fundamental thing, which is what led me into your office on that very fortunate day. Yes,
that's right.
Yes.
And yes, I think I was very much aware when I was moving into this other area of medicine, from being a very proceduralist in theatre. That's how I was trained, and in the tunnel of anaesthesia, but I was always aware that there was something else, that we were more than just drugs. And unfortunately, doctors now have become the gatekeepers to drugs more than thinking about other things, I think, and that's happened with the expansion of the pharmaceutical use of drugs.
What do you think that thing was that you said you were aware? You were aware there was something else. What do you call that? How do you quantify that?
I think it was with me all my life.
What do you call it?
My ethos, my ethos of my truth. My truth was that there was something else. Hugely.
So I mean, and we're going to get to what your treatment did for me, and specifically the laser light acupuncture, because I was really a neophyte. I came into your office, and the first session when I met you, I actually thought it was going to be needles. And she said, no. Your receptionist said there's no needles. And I was like, oh, okay. And, you know, you proceeded to ask me a lot of questions, and your questions, tell me why you were asking those questions.
Yes.
Why is it so relevant?
So that's the other thing that with respect to how I was trained as a doctor, as a young doctor, we had a very detailed history and examination, past history, childhood, everything. You go through the whole lot. And because we then establish a diagnosis, a differential diagnosis. Yours was menopause, but I'm just saying you get a diagnosis, you have an idea, then you examine the patient, and it supports what your idea already is in the history. The history tells you everything.
Right.
And with respect to you, with respect to my idea of how I treat patients, I was very fortunate, because I went and did my medical acupuncture fellowship, which brought back that whole history again, of taking a detailed history. Because with acupuncture, you look at what you had as a child as being a meridian of susceptibility, call it.
So give an example of that with me.
With you, glandular fever.
Right.
People who have had glandular fever, who get migraines, who have headaches, or have frequent tendon issues, but that's a liverish. It's liver.
Right. So it's related to the liver.
And it's not related to the liver being liver enzymes and your blood tests being wrong. It's related to a subtle idea of how your liver is working. It's like kidney and earaches. People who have lots of earaches as children. Some people never have an earache.
Right.
I've had patients who have never had an earache, but it's people who have continual earaches. Their meridian is kidney.
Right.
All right. So that gives you a history.
So what I'm hearing you say is that the history from the time I was young gives you a focus as to how you will then treat.
How you treat
Right.
from an acupuncture point of view.
Right. And so what did my glandular fever, my history of migraines, my history of anxiety tell you?
Well, that told me about the liver point. It's a common point, liver 3, but, a common point to be used.
Mm-hmm.
In fact, there was a very famous medical acupuncturist who actually really was the instigator of bringing acupuncture to the Western world in London, Felix Mann. He used liver 3 on every single person.
Right.
So I'm just saying there are points that each practitioner will use, and it's like anything. I use certain points,
mm-hmm.
and in my hands they work well. Someone else will have a favourite point, and in their hands it'll work well.
So tell me, because I was fascinated by this. With the first session I had with you, you did tell me that I would leave and I would feel like I wanted to sleep. I literally felt after leaving you that it was like the hand of God had been on my head, and this energy had come through me and out of me, and I literally felt like I wanted to sleep, and I did as soon as I got home. What did you do specifically? I remember you saying that I was retaining a lot of fluid. I do remember you pointing to my ear. What about the ear is significant for you?
I use the ear points a lot because they help with post-traumatic stress. And
which I also had.
Yes.
From a trauma in childhood. Yeah.
And most of my patients, I work a lot with pain, chronic pain. So a lot of my patients will have post-traumatic stress issues. And I'm not saying it's only post-traumatic stress, it's stress as well. There's stress points that I use a lot in the ear, and they tend to calm the nervous system down. So they dampen the nervous system, and they calm people down. There are tranquilizing, there are points that I use to your anxiety was an element. And I know with menopause, with lots of things,
well, the menopause
anxiety was.
I mean, that's what really it's my body. So I'm in my body, and I'm very in my body. I'm very self-aware. I've had many, many years of psychoanalysis, and so I'm a very aware person. But also, too, I'm an aware person to the degree that sometimes I can be hypersensitive, but I'd never experienced anxiety to the level that I had until I got to menopause.
No, it heightens everything. That's right.
And it was in my chest, and it was in my tummy, and it just progressively got worse and worse and worse.
So another thing that I think is really important with what I do is I'm tapping into I don't know the right word. I'm helping the autonomic nervous system regulate itself.
What does that mean?
The autonomic nervous system is the system of nerves that we don't think about, that happen automatically. So it's probably a word would be automatic nervous system.
Right.
For example, it helps. People might have heard of the vagus nerve.
That's what I read up on the vagus or vagus? Vagus nerve. I did read up on that, and I read that someone that's
so there are all these, and what happens is and if you some of our listeners might know about the chakras. So it's interesting that the plexus of the autonomic nervous system, which is a separate system, it's not the ones that help, the nerves that go and do our muscles, and we say, well, we're going to walk or we move, things like that. It functions in the what we are required to be as humans. For example, when you eat, we're eating, do we have to say, please secrete my enzymes, the gastric juices, please get my gut to work nicely while I'm eating? No, it happens automatically. When we're running from a lion, back in the old
adrenaline,
adrenaline. But do we say, please send all the blood to my muscles, my heart, my brain, and my lungs, so I can run, take it away from the uterus, the ovaries, the gut, take it away from non-essential things, because I need it in my muscles now. It auto-regulates all those things that happen automatically. When we're lying down, we have a pump moving the blood around. When we stand up, if that just stayed in the nice relaxed way it was, the hose being relaxed, we would all faint.
Right.
Because the blood, so you have to vasoconstrict your blood vessels in your lower limb. Right. So all that happens automatically.
It does.
When you sweat, do you say sweat because I'm hot?
No.
So all those things happen automatically, and I do believe that acupuncture, over the years studies have shown, but I can see clinically, and I've observed it many times, that there is a change in the autonomic nervous system when we treat.
Well, I saw those changes. I mean, I was a little bit skeptical initially, not because, I've had acupuncture a number of times and I've seen the results of it, but I was, as I said, a neophyte. I've never experienced menopause before. I didn't know what to expect. Mum is no longer here, and God rest her soul. I had no idea what I was about to embark on. But all I knew was that I had these acute symptoms that I wanted to be rid of. And this is what happens, I believe, to all women during menopause. We are told that somewhere in the distant future, we're going to go through this change, and it's a part of life, but we shouldn't talk about it. We shouldn't discuss it. We should shrink, and we should cower in a corner and whisper that we're menopausal.
Definitely years ago that it was like that.
But I know it's changing, but I still feel that there is, I was thinking about this last night while I was laying in bed. I thought, I have 53 years of experience as a professional, as an educated woman, as a mother, as a wife, as a colleague, as a friend. And this is not a time to shrink. It's a time to expand. And I know that can be incredibly difficult for women when they're having these acute, horrid symptoms.
And the thing is, some people have very bad symptoms. Other people breeze through menopause. And that's the problem. That's why I'm saying it's the group of people in the standard deviation, the bell curve of people. The norm will function quite well. They might have a few flushes, but it's not a huge issue. But there are people on the ends that have huge problems. When you've got those, you get anxious, you get frustrated. You're normally able to deal with things, and now you can't. It happens without any, just automatically, just happens.
Euahna, I counted how many symptoms I had. I had insomnia, and I've had it for 3 years now. Anxiety in my chest and my tummy. I had aching in my knees, in my joints. I had itchy skin. My skin wasn't
crawling.
Yes,
because it's the ants crawling. Is how we describe it.
A decline in libido, dryness in vagina. Fluctuation of hormones constantly, up and down, constipation, irritability, crying, and then I started to feel depressed. And I recognized it immediately because I had experienced depression after my mother died, and I experienced depression postnatal as well.
Yeah, so you had two issues. So you were primed to get it too, because people do get depressed, but not severely or often.
So you're saying that if you have a history of it, you're more likely to?
I think if you've got a history of things, I think you're more likely to, yes, I do. I mean, I'm not an expert, but I'm just saying in general, when I speak to my patients, I will see that sort of trend. Yes.
And here's the big one, the afibrillation, which I came to you and told you about.
That's right.
Which got so bad, this is heart palpitations and heart murmurs, that I ended up in Cabrini Hospital seeing a doctor, and they were worried that I could potentially be having a heart attack. And this was beyond my comprehension.
So anxiety brings on AF too as well.
Right.
So getting back to how I saw you the first time I treated you, and a number of my patients are like this because I see people at the end. I'm the last resort. I'm the doctor. I'm the doctor of last resort.
You're the last resort?
Yes, which is unfortunate, but I am often called the doctor of last resort. And so my patients, when I see them, are so heightened. you know, everything is wound up, pain or whatever, you know. I'm saying you were wound up, anxious, the whole system was heightened. So you don't have to, and I didn't do a lot that first treatment. You might not remember, but I didn't do a lot.
I do remember you saying
I'm not acupressure.
Yes.
Saw some points change, which it's a method I use.
Yeah.
And I knew then that tells me, that's almost like it's examining you and assessing. You don't need much today. And I didn't do many points, but I knew you would, the more heightened you are, the more likely you are to do what happened, to be flattened. Yes?
Okay.
Because your points are very active. So we talk about grades of acupuncture points. Anyway, I won't go into that. But basically, that's what I assess at the beginning. So then I can titrate. I'm an anesthetist. And
what does that mean? What does titrate mean?
I suppose titrate, being an anesthetist comes naturally to me because we give you drugs and see what happens and then give you a bit more and keep you asleep. You don't have just one whole drug, one injection at the beginning and it keeps you asleep for the whole operation. It doesn't happen like that. We actually have to keep on titrating, giving you a little bit more of various things to keep you anesthetized adequately for the surgery and for your brain, to keep you asleep.
Right.
So titration, in chemistry, people would have titrated with pipettes anyway. Drug tab, to get a reaction, a chemical reaction. So I call myself I'm a titrationist because I titrate my acupuncture according to what I think you need, and my photobiomodulation when I use my laser.
So that to me is absolutely phenomenal that you have that, that right brain, that very medical brain, that very logical brain, that very scientific brain, and you have the left one, which is the creative, that all-encompassing. And so you're looking at a human being in the whole, the essence of who they are, Often that word holistic has been hijacked, and I don't like to use that word. I've just raised it because it is very hijacked.
It has been hijacked. It used to be a good word.
It has. Like the word feminism, like the word, manifestations. Most of the time, like the word mental health. When I hear that word, I cringe sometimes because I think this is going to be so problematic for psychiatry in diagnostic, so problematic when everyone just throws out that they've got some mental health issue without really fundamentally understanding the concept of what that means. Because a human being is a mind, a body, and a soul. And so the fact that you can look at me in that context,
I think, yes, because you went back to why, what I felt when I was younger, why I felt how I felt things. Medicine wasn't all encompassing what I wanted to be as a doctor.
Yes.
And if you look back to all the ancient, medicine, Greek,
Egyptian, yes.
Indian, Ayurvedic medicine.
Yes, definitely.
Chinese, TCM, traditional Chinese medicine. Hippocrates, well, I have to say, it was about what surrounds you, what, your emotions, your environment, everything. And so they understood. And I think we are, life's so busy now, we're forgetting all that.
Which is very Gestalt therapy, that whole concept of can the self exist in isolation without the environment? And the answer is no. I mean, there is a self, because psychoanalysis does say that the self does exist. However, I truly believe that we can be both. You have yourself,
yes, and I've had times where I've needed to do things, and I've gone to the gardens, the botanic gardens, and then I go away and I don't visit them for a while because I'm too busy, and I've just gone back again. I thought, oh gosh, I remember what it's like to come in here. And you just change when you're in that environment.
Yeah, it recalibrates you, doesn't it?
That's right. The other thing that happened with you was I had to ground you.
Oh, I know.
Because you were, and that's what I see. I feel the energy not the energy, that's the wrong word. Don't use that.
I needed grounding.
I see that because you're a bit all over the place because you didn't know how to cope with this. You're normally very much in control
exactly
of how you run your life, and yet this was totally overtaking you. And so I did those points I used, but also grounding points,
which are where
top of the head.
Yes. Oh,
That's one of them.
Yeah.
But also it's not just one point. The liver point for you would be grounding you.
Yeah.
For Joe Blow with earaches and a different constitutional point, whatever that is, whichever meridian you choose, that would ground them.
Right.
You see, so that's what I loved about when I learned acupuncture. It gave me another tool. And one of my early patients who was involved with work care, and I think she was involved with those sorts of things, she said, I was writing some report, she said, Dr. Varigos, you should just say that you have another tool.
Well, you do.
Yeah. But
you have many tools.
I have many tools.
You have many tools.
But I had another tool to use that they did not think about.
Yes.
And this is 30 years ago.
Right.
It's a long time ago when I started. 95.
I know, but I feel like, I honestly, I feel honoured to have connected with you, and I feel honoured to be sitting here with you discussing this because, you talk about you knew there was something else. I think I knew that there was something else from a very young girl, but when you're dealing with trauma, and that's another episode, domestic violence is a whole nother episode, but when you're dealing with the trauma of growing up in that kind of environment, it gets shut down because your natural instinct is survival, to survive. And so, but it's always been there, that inner silent voice that was dulled at a very young age and then resurfaced and reemerged when I started my journey with analysis, and then went on to study to become, a psychotherapist and a counsellor later. And it's really now it's a guiding faculty for me. It's a guiding faculty in everything that I do when I connect with people or choose not to connect with people, when I'm deciding whether or not to have surgery with a particular doctor. That's the thing that I think guides me in everything. So I love that you talk about it in that way, But I did want to talk to you. I did want to say the specific symptom of the afibrillation, because that's a really serious one.
I think I put you on magnesium.
You did. You did.
Because you were having leg cramps as well, I think.
Yes. And you said to me, you gave me this beautiful golden nugget of wisdom and scientific knowledge, is the heart is a muscle, Therese. If you take extra doses of magnesium, whatever it was that you prescribed for me, it will help your heart. And it did.
Well, magnesium is important with all cells, the function of all cells, but very important in conduction of nerve impulses. So it's very important for nerve pain, because I deal with a lot with that, but nerves, muscles, and also the heart, because the heart is pumping by nerves telling it to pump, right? And especially arrhythmias. Yes.
And I started doing some research on specifically menopausal women with arrhythmia, and it was a Good Morning America show where Dr. Tara Narula is her name, and she'd conducted this this research on 80,000 women, postmenopausal women, and 25% of them showed signs of arrhythmia, and the common symptoms were insomnia and stress. And they were
definitely stress causes arrhythmias. Insomnia, well, we know how important good sleep is.
I know.
Poor sleep with the flushes and the sweats is something that I do. That's also one of the big things that I would be high on my list of trying to help patients. So I use lots of points that would help with sleep. And there are specific points. But again, it's that idea of constitutional treatment for the patient, for any patient that walks in my door.
And constitution, again,
means what you've told me in your history.
Yes.
What you tell me, what I'm getting. And, TCM, you take the pulses and look at tongues, and you get an idea of the subtle changes in the body. And that leads you to the constitutional points that you would use. And I always include them with patients, but also then add what we said about the insomnia. So if people have a really difficult time with sleeping, then I'll probably add a couple more points over a period of time, never all in one hit.
Yes.
This happens titrated. It's titrated.
Yes. And
according to what you tell me.
Yes.
And you come back, and then I say, right, so And often what patients will find with acupuncture generally, and I think even my whole time now that I've treated, and with photobiomodulation, it's similar, that there's a decrease in intensity, frequency, and duration of the symptom, whatever it is.
Well, I did. After my third session, I didn't have any night sweats at all. It was really interesting because I could feel them almost under the surface of my skin,
but not coming out,
which was phenomenal that I could actually feel that. So it was the third session that I started noticing. By the fifth session, I didn't have any night sweats. And continuing on 10 months down the track, it was almost a process similar to psychoanalysis of 2 steps forward, 1 step back, 2 steps forward, 1 step back. And then there's a new symptom.
Yes, that's true.
And then I got the new symptom of depression, which for me, and I think
you understood that.
I understood it very quickly. And I had a panic attack because I'm thinking that, I'd already had my doses of depression. And here I was having it again, ended up in my GP's office. And I think I told you that we had a bit of a question about it. We had a questionnaire. And, he said to me, well, let's, get you on some depression medication. And, earlier in my experience with depression, I had a very specific therapeutic goal that I didn't want to be medicated.
Drugs.
Yeah. And that was specific to me because my father had mental illness and I didn't see him as getting any better. So I didn't want to take it. I wanted to just work through whatever I needed to work through. But this time in my life, I needed it. And I knew it wasn't going to be forever. And
also the drugs are better now.
Well,
the drugs are better now. They're than they used to be. There were very few drugs for depression.
I know. And so he gave me an anti-anxiety. He gave me desvenlafaxine. And he said, because of your history, Mum died with breast cancer at 43, we don't like to prescribe hormone replacement therapy for women who have a history of breast cancer. Let's give you desvenlafaxine because it has been shown to help women who have night sweats and who have hot flushes to abate those symptoms. And I said, okay. And I said, that's phenomenal. He did say, however, the caveat was, it's going to affect your libido. And I said, okay. I mean, I had to, the irony is not lost on me. I thought, I'm sure that it was male scientists who actually designed this drug. I'm sure it was, right? So you take the antidepressant and you've already got a decreased libido. But the concept of having an orgasm is then decreases even more. And I thought it's a short period. You know what I mean? And I'm definitely sure it was a man who designed these drugs, because if a group of women had designed an antidepressant, I don't think they'd be talking about their libido and decreases in libido, what have you. But I reconciled that, the Therese at 53 needs the support in that way.
You need just a little bit of something for a short period of time.
Yes, and I'm good with that. And I think that.
And that's how I use drugs generally, actually. If I do have, because, I am a doctor, so I see patients, I will introduce, magnesium and all those things that I love. And as my daughter said, you have everyone on magnesium. And I said, no, everyone gets magnesium because we're a bit depleted. We are depleted in magnesium.
Okay.
Yeah, I had a patient and she was involved with agricultural, her husband was, and she said, oh, well, yes. It's no wonder you're telling me to take magnesium, because our soil in Victoria specifically is very depleted in magnesium. So even though we're eating well, we're not getting
the nutrients right.
that we would normally get from our food in magnesium. So just to go back to magnesium, because I do think it's very important for everything, is that you can have slow absorption magnesium and higher absorption. The powders absorb more quickly.
Great. Yes, the powder's wonderful.
In the evening to help you relax and sleep and restless legs. The slower absorption ones are better for the cardiac issues, because you can take them in the morning and during the day without falling asleep or feeling tired. But they actually help with your slow absorption, meaning they're giving you a slow amount of magnesium level in your body. The fast ones will boost quickly. So for at night, people with restless legs or cramps, you take magnesium. It's faster. Okay.
There's just so many things, Euahna, and that's the thing with menopause. It's like watching this space where it's constantly changing. I noticed last night too that I was getting a few night sweats, and maybe that has to do with the fact that I'm still coming to terms with this new drug. Like he actually told me when he prescribed it, it will take you up to 6 weeks to see the maximum benefits. But beyond 6 weeks, that's where you won't see any changes. And I'm on my 3rd week, and certainly it's definitely helped with the symptoms of, the depression and the anxiety. And the night sweats, let's watch this space and see what happens. And I'm really making a conscious choice to be a lot kinder to myself. Stay tuned for the Food for Therapy podcast, part 2 of menopause. Dr. Varigos and I will be dispelling some of the myths in Eastern and Western medicine in the treatment of menopause. I'm Marie-Therese Bolden, signing off for now. See you soon.